When you first have a question or problem with your health, the first person you are likely to reach out to is your doctor. That person is usually a doctor, but there may be a physician assistant or a nurse practitioner. Your primary care provider will probably be involved in your health care for a long time, so it's important to choose somebody who will work well with you. Joining us now is Dr. Gladys Martinez of Boca Raton Regional Hospital to tell us what to look for in a primary care provider. First of all, doctor, thank you for joining us. Just a few questions here right off the top of the bat. What is a primary care physician, and what's their role in someone's health?
Well, a primary care physician is either an internist like myself or a family practitioner. It could also be, as you said, a nurse practitioner or some other health allied professional that helps that primary care physician, whether it's an internist or a family practitioner, do their job correctly and keep together with the whole primary care network. Right.
And having it to prevent an illness, what role does a primary care physician play if a patient is admitted into a hospital?
Primary care physicians normally follow their patients through their hospital stay. There is a big trend with hospitalists who also are just based in the hospital, and the primary care physician, if they choose not to go to the hospital, follow their patients along with them.
Okay, a lot of doctors out there. What should you look for when you're choosing that primary care physician?
Primary care physician, you should look for someone who's board certified and someone that you can have a good rapport with, someone that you feel comfortable talking to. And that's very important in terms of patient and doctor relationship.
I was going to say comfort, it has to be a big thing. I mean, it's the person you're coming to first and foremost.
Exactly. Comfort is very important in that relationship.
And many patients are quick to run to a specialist when they need care. Why is this not always the best thing to do, just to run to a specialist right away?
Well, a specialist, what happens is that you get fragmented care. They go to different doctors for different problems, and these doctors typically, if the patient doesn't tell them they're seeing other doctors, don't speak to each other. The primary care physician is the person that sort of is the gatekeeper that keeps everything together.
I was going to say, it can be quite a jumble of things to talk to different people, so having that one person to depend on is key.
And medications that are given by different doctors, sometimes they don't talk to each other because the patient doesn't tell them, and these medications can interact with each other.
Okay, well there you have it. Boca Raton Regional Hospital and our sponsors are our experts and underwrites the Ask the Doctor feature.